Thank you, Governor. Regarding hospitalizations reaching a record yesterday evening, do you expect things to get worse before they get better?
Well, I hope not. It's indicative, I think, of what we've seen with community spread. It's more general population. Prior, when we hit our high of 417, a lot of that was tied to some of the nursing home outbreaks, some of the other outbreaks at some of our manufacturers. So right now, it's more general population tied, I believe, to community spread. But I think, the main takeaway needs to be the team, we're on the phone every day with them. So the outreach and communication and coordination has been exceptional, asking if they need anything, is there anything that we can provide, and they're indicating that they're doing fine, PPE is fine, they're at capacity, they're monitoring their workforce very closely. Those healthcare professionals have been on the front line since March, and it's been a long 7 months, so they're managing and monitoring that. They have surge plans in place, and they're really doing the things that they need to do that we really put in place a long time ago, back at the beginning of the outbreak, so that we would be prepared to, which was our original intent, to flatten the curve, manage our healthcare resources so we didn't overwhelm our hospital systems, and then continue to do everything we can to protect our most vulnerable. So, we're seeing less vent usage, and we're just doing a better job of treating the patients. But we're continuing to monitor it every day. I don't know, Dr. Pedati, if you want to talk about the timeline that follows some of the increase.
Yeah, I think I would say, just like everything else, right? This is another example of a place where there's a lot of coordination that's necessary between public health, between our healthcare providers who have been working, hard, for patients on the front lines for months now and continue to do that. I think it's an important place where we have conversations across systems, across providers, to understand how we can work together and what we're seeing. And again, just like so many other parts of this response, there's not one single driver here, right? So we know that in some situations we're seeing people who've delayed care. We want to do everything we can to support Iowans to access the routine care that they need, including staying up to date on vaccines, which includes the flu vaccine for everybody 6 months and older. And we want to make sure that we have those continued touch points, not just in regions or even across the state, but we speak quite regularly with our neighboring states, and with our federal partners to make sure that we're understanding the resources, the needs, and keeping a close eye on what's going on. And it all ties back to, again, the more we can do to follow the public health recommendations, the things that include really staying home when you're sick, maintaining social distancing, using face coverings, and practicing frequent hand washing. The more we can support, each other, right, in making those decisions, those healthy decisions, we'll see that spread decrease, and we'll be able to protect our most vulnerable Iowans as we move forward into the fall.
Governor, are there